Hello, everyone, and welcome to our question lab. This evening, we'll be covering the topic of biochemistry. And leading our discussion today is Dr. Paras Vicaria. Paras, do you want to introduce yourself?
Yeah, thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident at UT Southwestern in Dallas, Texas. I originally graduated from pharmacy school in Missouri, went back home to Michigan to do medical school, and have been working with USMLE-Rx as an RX coach, working with students to prepare them for USMLE Step 1 and Step 2K, and am happy to lead tonight's session.
Earlier, I mentioned RX Coach. RX Coach is our coaching and tutoring program, of course, brought to you from the team that brought you first aid in USMLE-Rx, and we'll talk more about that later. But what you should know for now is that the methodology we're going to employ as we do these 4 question dissections is going to be the same methodology we use in RX Coach. Let's go ahead and get started with our first question this evening. As you can see, the answer choices are missing, and that is by design. We cover up the answer choices because we do not want the answer choices to guide or dictate your thought process, and we certainly don't want you to see an answer choice that you're unfamiliar with, which causes you to panic as you're trying to answer the question. So once we've covered that up, we will read the last sentence or the lead-in. Let's do that now. A mutation in which of the following proteins is most likely responsible for this patient's condition? A mutation in which of the following proteins is most likely responsible for this patient's condition? And once we read the lead-in, we'd like to ask our students how many steps they think this question will require. An example of a 1-step question could be when they ask you for the diagnosis. An example of a 2-step question could be where they ask you what is the treatment for a diagnosis. And an example of a 3-step question could be where you're asked what is the mechanism of action for a treatment for a diagnosis. So with that in mind, please let us know in the question box how many steps you think this question will require. And the reason we do that is because we want you to have an organized thought process. We want to make sure that you're answering the right question. We also read the lead-in first because we want you to know what the test writer is asking so that you can pick up on all the relevant clues when you read the vignette for the first time and avoid having to reread it and waste valuable time on test day. So I see the responses coming in. Let's go ahead and read that vignette. A 25-year-old man comes to his primary care physician for a physical examination before starting a new job. His family history is significant for a father and grandmother with cholesterol issues. For this reason, the patient has maintained a healthy diet and exercises 5 days per week. He denies drinking and smoking. Physical examination reveals a well-developed, well-nourished adult man with well-demarcated white plaques on his upper eyelids. Laboratory studies show thyroxine concentration, normal. Thyroid stimulating hormone concentration, normal. Total cholesterol concentration, 300. LDL concentration, 200. Triglyceride concentration, 130. And HDL concentration of 60. So once again, a mutation in which of the following proteins is most likely responsible for this patient's condition? So we want you to go ahead and start thinking about the important clues in this vignette as I hand it off to Paras.
Thank you, Sean. So we're going to go ahead and kind of show you what we think are the important clues in that vignette and the lead-in. So starting off first, demographics, 25-year-old man. That will always give you some clues as to what you should be thinking about in terms of disease, demographics, things like that. Then other things that are also important that we highlighted in that slide are, family history. I think that's going to be relevant. The other thing is they're telling us that he's doing a pretty good job of, living a good lifestyle. But he's got these plaques on his eyelids. What could that be talking about? Definitely seems like something important. Maybe we're not sure what it is. And then they give us some important labs. And I won't delve too much into that without giving it away. But obviously that's going to play a role in what this question is asking. So this question is asking about a mutation in a protein responsible for the condition. How many steps do we think this question is? Well, I think first we need to figure out what condition this patient has. Then we maybe from there, what is the mutation in that condition? It could be a 3-step question. Maybe there are certain types of like subtypes within that disease. So disease and then subtype disease and then mutation of that subtype. So maybe a 3-step, at least 2 steps, maybe 3 steps here. So we're going to go ahead and look at those answer choices. And as you can see, we have 5 answer choices for this question. And then what we're going to do is we're going to go ahead and start at the bottom and work our way up to the top. Some of you may wonder why we recommend doing that. And the reason we do that is to make sure that you get through every answer choice and you don't miss anything. A lot of times students will see something they like at the very beginning and then select it without getting through all the answer choices. So this way you prevent yourself from biasing yourself. So I'm going to go ahead and do that right now, starting at the bottom. Answer choice E, lipoprotein lipase deficiency. D, apolipoprotein E. C, apolipoprotein C2. B, apolipoprotein B100. And A, apolipoprotein A2. So start thinking about which of those mutations you think is responsible for the condition the patient has. And we're going to go ahead and open up that poll and we'll talk about it in just a few seconds.
Excellent. Please keep in mind that all of your responses here tonight are completely anonymous. So take a moment to select the answer which you believe is correct. If you don't know what the right answer is, don't worry. Take your best guess. We'll always wait until about 2/3 of the audience has responded before we move on. So we'll give all of you a few seconds here to submit your responses. I did see somebody ask us if the new version of First Aid is available, and yes, it is available online. It may be sold out through various retailers, but it is available, and you can go online to purchase that or try to order it for a future delivery date. All right, and let's see what all of you selected. And it looks like we have a clear favorite here, with 60% of you guys selecting answer choice B, apolipoprotein B100. So let's see what the correct answer is. And it is in fact B, so great job everybody. 60% of you got it right. But let's make sure you got it right for the right reasons. And if you didn't get it right, don't worry. Boris is going to explain it to you now.
Thank you, Sean. Great job, guys. This is definitely a tough question. One of those concepts that takes a lot of repetition to really nail it down. But let's review what this 25-year-old patient had. So he's got a family history of cholesterol issues, and you can tell that he's actually doing a really good job with his lifestyle. He's exercising 5 days a week, which is more than a lot of people. He doesn't drink, he doesn't smoke, but he's got these plaques on his eyelids, and that's referring to xanthelasma, so they can be white, yellow in color. On top of that, he's got an elevated LDL and an elevated cholesterol, okay? His triglyceride level is normal though, and his HDL is also normal. So on the next slide, Sean has actually gone ahead and pulled up one of the tables in First Aid that talks about familial dyslipidemias, okay? And when we look at what this patient has, we know that he has elevated LDL and elevated cholesterol, and you can see the one that best matches with that is type 2 familial hypercholesterolemia, okay? This is an autosomal dominant disease. It can be due to either abnormal LDL receptors or defective apolipoprotein B100. In this case, that's what we were given, the apolipoprotein B100, so that's what would be the best answer here. Okay. In this condition, as mentioned, you have elevated LDL and cholesterol, so you can have early heart attacks. You can have cutaneous manifestations of high cholesterol, so xanthomas, xanthelasmas, things like that. So we're going to stay actually on this table, and I'm going to read out some of the other answer choices, and then hopefully you guys will see what that would present with. So answer choice E was lipoprotein lipase, and answer choice C was apolipoprotein C2. As you can see, both of those are consistent with type 1, lipoprotein lipase deficiency or apolipoprotein C2 deficiency. So in that, you would actually have a different presentation. You would have elevated triglyceride levels, and we know that our patient had normal triglyceride levels, okay? One of the other answer choices was apolipoprotein E, As you can see, that is talking about type 3 or dysbeta-lipoproteinemia. With that one, you would get elevated VLDL, chylomicrons, and you also have a couple other cutaneous signs that this patient doesn't have. So xanthomas on the palm, other areas as well. And this one is probably a tougher one to differentiate between type 2, but mainly it's those serum markers and what was elevated in this patient. And then lastly, apolipoprotein A2 was answer choice A. That's actually found in HDL and would result in an issue with HDL, which is not what we have here. So as you can see here, knowing those different serum markers of what would be elevated, knowing what they would present with both cutaneously and also with their organ systems will really help differentiate these different types of dyslipidemias for you.
Excellent. Thank you, Paris. Great job, everybody. 60% of you guys got it correct, which is wonderful. Let's keep the momentum going and move on now to our second question of the evening. Once again, the answer choices are covered up. That is by design. We don't want the answer choices to guide or dictate your thought process, and we don't want you to see an answer choice that you're familiar with that causes you to panic as you're answering the question. We've covered up those choices, and now we will begin by reading the lead-in, which is the question itself. So here we go. If her symptoms are secondary to an essential amino acid deficiency, which amino acid would be deficient? So with that in mind, please let us know how many steps you think this question will require in the question box. And once again, the reason we do this is because we want you to have an organized thought process, and we read the lead-in first because we want you to know what the test writer is asking so you can pick up on all the relevant clues the first time around and avoid having to reread that question for clues and waste time on test day. I see the responses coming in, so let's go ahead and read that vignette. A 42-year-old woman presents to the physician with lethargy, cold intolerance, and a 15-pound weight gain over the past 3 months, despite concerted efforts to cut her calorie intake. On examination, she is found to be an obese, well-appearing woman in no acute distress. Her neck is supple and non-tender, with a diffusely enlarged thyroid gland. Patellar tendon reflexes are 1+ bilaterally. Her skin has patchy areas of dryness. If her symptoms are secondary to an essential amino acid deficiency, which amino acid would be deficient? I want all of you to start thinking about the relevant clues in this vignette as I hand it off to Paris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So starting at the top, we have some nice signs and symptoms. And then there's also that phrase, weight gain despite efforts to cut her calorie intake. Whenever you see something like that, something is happening despite the patient trying, that really should, clue you off that, well, something pathologic may be going on here, okay? We're given some physical exam findings, some reflex signs as well. We'll talk about that. And now the lead-in is asking us about amino acids. So definitely a nice biochem question. So how many steps do we think this question is? Well, one, I think we need to figure out what this patient has. Two, maybe know the pathophysiology or the physiology of it. And three, then figure out which of those things could be deficient that could cause these potential symptoms. So at least 2 steps and maybe 3 steps if it's stretched out. So let's go ahead and take a look at those answer choices. So once again, I'm going to go ahead and start at the bottom and work our way up to the top. This way it ensures that you get through all the answer choices and you have a clear thought process. Answer choice E, tryptophan. D, phenylalanine. C, histidine. B, glycine. And A, arginine. So we're going to go ahead and open up that poll. Select the answer choice you think is most correct, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. So we'll give all of you a few seconds here to respond, and then we'll go over the correct and incorrect answer choices. Looks like there is a clear favorite already. Keep in mind that on test day, there is no penalty for guessing. So if you are not sure of the answer, definitely select something and don't leave it blank. Certainly no penalty for guessing tonight. So if you're unsure, just take your best guess. We're all here to learn so that we can get it right on test day. All right, and let's see what you selected. Once again, a clear favorite, 52% of you selected phenylalanine, and let's see what the correct answer is. And the correct answer is, in fact, D, phenylalanine. So great job today. We're doing well with our first two questions. Let's keep the momentum going. But before we move on, let's have Faris explain this to us to make sure we got it right for the right reasons. Faris.
Great, thank you, Sean. Nice job again with this question as well. Yes, the answer choice is D. And as you can see here in that first, this table on amino acid derivatives, this is a very high yield table to know, or diagram to know. You can see that phenylalanine gets converted to tyrosine, which helps in the production of thyroxine, okay? Also on this diagram, you can see a lot of the other incorrect answer choices. So tryptophan was the second most highly selected answer choice. You can see that that gets converted to niacin and serotonin and eventually melatonin. Histidine can get converted to histamine. Glycine can get converted to porphyrins, which as we know are part of our heme synthesis pathway. And then arginine can get converted to a few things there as well, okay? So let's go back to our vignette, our question. This was a lady who has some classic symptoms of thyroid dysfunction, feeling, cold intolerance, weight gain, dry skin, classic signs and symptoms of hypothyroidism. So this patient may not be synthesizing enough thyroid hormones, okay? As we talked about, phenylalanine is a precursor to tyrosine, which is needed to make thyroid hormone. So actually on the next slide, we actually have that diagram of thyroid hormone synthesis, and you can see there in that blue cell how tyrosine is being added onto thyroglobulin, and then eventually you're creating monoiodotyrosinase, tyrosine. So tyrosine is an essential component to the making of thyroid hormone. And so that's why tyrosine is the one thing that's missing, and that comes from phenylalanine, which is why phenylalanine is the best correct answer in this question.
Excellent. Thank you, Faris, and great job, everybody. I know we briefly mentioned RX Coach. I want to talk to you about it just a little bit here. RX Coach, like I said, is our new tutoring and coaching initiative. So, oftentimes when students are studying, they'll listen to their friend's advice or look up something online, and they have to keep in mind that what worked for your friend or what worked for somebody that posted something online may not necessarily work for you. And that's not because your friends aren't giving you good advice or there isn't good advice on the internet. It's simply because we are all different. We learn differently, we think differently, and we apply what we know differently. By using RX Coach, you can take the guesswork out of studying. You can have us show you and analyze your strengths and weaknesses, help you create a personalized study plan, and then work with you on a one-on-one basis to help implement that study plan and ensure that you're bridging knowledge gaps, learning the content, you're able to apply those concepts and that material and answer questions correctly by employing good test-taking skills. That individualized approach is not the same approach that you get at a USMLE program, because those are really content heavy. Although we do content review and provide you access to all of our resources, we take that individual approach to help you maximize your potential by focusing on your individual strengths and weaknesses, which is why we have had so much success with our program. So if you're interested in getting that edge and really reaching your peak potential, reach out to us at rx-coach.com. You can set up a free consultation to talk with one of us about the program and how it can benefit you. If you'd like some generalized study advice, please visit us at firstaidteam.com. Now, RX Coach isn't just for students who are weak. It's for anybody who wants to do better. Just like athletes have personal trainers and coaches, so do medical students. And we're here to help you every step of the way. So if you'd like to reach out to us, please do so at rx-coach.com. Schedule that free consultation so we can talk about the program and how it can benefit you. We work with students that graduated 10, 15, 20 years ago that have done well on the exam as a result of our coaching and guidance. We've helped people break 250 multiple times. So whatever your goal is, rest assured that RX Coach is here to help you on your journey. and we'll help you in any way we can. All right, with that, let's go ahead and move on to our third question this evening. Once again, the answer choices are covered up. We will begin with the lead-in. The enzyme that is most likely deficient in this disease is found in which part of the cell? The enzyme that is most likely deficient in this disease is found in which part of the cell? Let's read that vignette. An 18-year-old woman comes to her family physician after experiencing severe leg cramps when running to catch a bus. She recounts a similar recent episode that also included a burning sensation in her legs after running with a friend for half a mile. The next day, her legs felt weak and sore. The patient is able to take long, slow walks without experiencing cramping or burning. A muscle biopsy is obtained. Laboratory studies reveal white blood cell count of 6,000, hemoglobin of 13.8, hematocrit of 38, platelets of 210,000, neutrophils 52%, eosinophils 1%, basophils 0%, lymphocytes 31%, monocytes 7%, creatinine kinase 4279. A urinalysis reveals myoglobinuria 761. The enzyme that is most likely deficient in this disease is found in which part of the cell? Once again, we'll let you start thinking about the important clues in the vignette as I hand it off to Boris.
Thank you, Sean. So we'll go ahead and show you that. And I do want to apologize. One of the things here did not get highlighted, and we'll talk about that in a second. But 18-year-old woman, so demographics, as mentioned, important. What are her signs and symptoms? She's getting severe leg cramps when she's running to catch a bus. That's interesting. You know, I don't normally think of that as a long distance, so I find that interesting. You know, more comments about her legs being weak and sore. We have a lot of normal lab values, and we also have a creatinine kinase that's about 4,300. Excuse me, and then that urinalysis, which I had meant to highlight as well, but that's showing myoglobinuria in the urine as well. Okay, so hopefully our brains are starting to think of some things. Now the question's asking us about an enzyme and where in the cell it is. So how many steps is this question? Well, I think this is probably a three-step question. I think one, we need to know what disease this patient has, this 18-year-old woman has. Two, what's the enzyme deficient in that disease? And three, where in the cell that enzyme is found. So a nice three-step question here. So let's go ahead and take a look at what answer choices we're working with. Answer choice E, rough endoplasmic reticulum. D, proteasome. C, mitochondria. B, Golgi apparatus. And A, cytosol. So we're going to go ahead and open up that poll. Select the location you think that deficient enzyme is would be found in, and we'll talk about it in just a few seconds.
Excellent, thank you, Boris. So we'll give all of you a few seconds here to respond before we move on to our last question of the evening. Please keep in mind that we do have a special offer for all of you in attendance, and Kate will be conducting a raffle at the end of tonight's question lab, and one of you lucky winners will win a very valuable prize. So make sure you stick around because you must be present to win. I see the responses are coming in. We'll give all of you a few more seconds here. All right. Let's take a look and see what you selected. In first place with 49% was mitochondria, and in second place with 28% was cytosol. So let's see what the correct answer is. And the correct answer is A, cytosol, and 28% of you got it right. It is a challenging question. Don't worry if you got it wrong. Boris is going to explain it to you now.
Great, thank you, Sean. Yeah, definitely a tough question. So we know that this patient's having some leg issues, especially after just minimal exertion, okay? Also a high CK and some myoglobin in the urine. So actually on the next slide, Sean has gone ahead and pulled up a nice table of our glycogen storage diseases. Very, very high yield stuff for biochemistry. And if you look down at type 5 or McArdle's disease, you can see that a lot of the findings listed is what our patient has. Painful muscle cramps, myoglobinuria, red urine. So this patient has McArdle's disease, and that's why they did a muscle biopsy, because that would show those results. So in this disease, the deficient enzyme is skeletal muscle glycogen phosphorylase or myophosphorylase. Okay, it's a necessary enzyme in the glycogenolysis breaking down of glycogen. It's important in glycogenolysis. This process occurs in the cytosol. So that's why answer choice A, cytosol, is a correct answer. Okay. So glycogen accumulates inside muscle cells because it's deficient in that enzyme, and then thus these patients have sufficient glycogen, they just can't break it down when they're exercising or doing something strenuous. So that's why they get pain in the muscles, and their muscle starts to break down. So let's go back to our vignette, and we'll see now how those findings lay perfectly with what our patient had. Okay. But let's talk about the other answer choices and what those could maybe be getting at as well. So rough ER, it's a site of a lot of protein synthesis, especially ones that'll be secreted or either targeted for lysosomes. So kind of broad there. Proteasome, defects in proteasome can be seen, let's say, in Parkinson's disease, but not so much exercise-induced myalgias. C, mitochondria, I believe that was the most highly selected answer choice. There are a lot of biochemical pathways that take place there. Fatty acid oxidation, Krebs cycle, acetyl-CoA production. However, what was important was, those three steps. One, what's the disease? Figuring out that this was a glycogen storage disorder. Two, what's the enzyme that's deficient? And then three, knowing it's in the cytosol, okay? So there's another disease in the mitochondria, carnitine CPT2 deficiency that can present with similar issues, but it would present a lot earlier in age to this patient. So this is likely a glycogen storage disorder. And then lastly, Golgi apparatus. One thing you can really think about with that is eye cell disease, but you have a lot of other abnormalities like clouded corneas, coarse facial features, which we're not seeing here. So this is a glycogen storage disorder, and cytosol is the correct answer in this question.
Excellent. Thank you very much, Boris. Great job to those of you who got it right. To those of you who didn't, don't worry, you'll get it right on test day. Now, I saw a lot of people say McArdle's and then get the answer wrong, right? And I saw a lot of people say this was a one-step question. Well, it wasn't a one-step question. It took multiple steps for us to get to the correct answer. But if you're one of those people that got this question wrong and said, oh, I knew that, but you still got it wrong, that could be a test-taking deficiency. And we're here to help you with that. So, if you're studying and you're not making the progress that you want to make, if you're putting in a lot of time, but the results aren't matching your efforts, if you're plateauing, reach out to us at rx-coach.com. Let us get involved and help you out. Every single student that's come to us so far has accomplished their goals, and we trust that your experience will be no different. We'd love to make you one of our success stories. So rx-coach.com if you're interested in learning more about the program. And like I said, you can schedule that free consultation to talk to us about it and how it can benefit you. So with that, let's go ahead and move on to our last question of the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following enzymes is most likely deficient in this patient? I'll give all of you a few seconds here to respond in the question box and let us know how many steps you think this question will require. I see the responses coming in, so let's read that vignette. An 11-year-old boy is brought to the emergency department by his mother because of seizure, excessive sweating, dizziness, and nausea. These symptoms occurred following a 32-hour trek without any food, as the boy was stuck on a mountain because of bad weather. His mother mentions that the patient has had similar complaints in the past with fasting. He takes no medications. Temperature is 37.2 Celsius or 99 Fahrenheit. pulse is 120, and respiratory rate is 22. On physical examination, there is generalized decreased muscle tone, and the liver and spleen are palpated a few centimeters below the left costal margin. Laboratory studies show positive urinary ketones, increased creatinine kinase, and decreased glucose levels. Lactate levels are within reference ranges. Which of the following enzymes is most likely deficient in this patient? I want all of you to start thinking about the relevant clues in this vignette as I hand it off to Paris.
Thank you, Sean. So a lot of information in this vignette. So there's going to be some important clues here, and we're going to have to make note of them. So demographics, this is a pediatric patient, 11-year-old boy, and he's got some interesting seizures that started 32 hours after exercising without food. And this has happened before, especially with fasting. We also have a couple abnormal vital signs, a little bit of elevated heart rate. And then physical exam, there's a good amount of stuff. We can see that the liver and spleen are palpated. We can see that there's some things in the urine, ketones, there's increased CK, there's low glucose, normal lactate. All of these things are going to be important, and you'll see why when we talk about this question. But it's important to make sure that you're highlighting what's going to be relevant for this question, okay? So now looking at that lead-in, obviously the most important thing is which enzyme is deficient. So how many steps is this question? Well, I think this is probably a two-step question. I think one, we need to figure out what's going on with this patient, what disease does he have, and then two, what's the enzyme deficient in that disease? So a nice two-step question here. So let's go ahead and take a look at those answer choices. And once again, we will start at the bottom and work our way up. Answer choice E, myophosphorylase deficiency. D, lysosomal acid maltase deficiency. C, glucose 6 phosphatase deficiency. B, debranching enzyme. And A, branching enzyme deficiencies. So we're going to go ahead and open up that poll. Go ahead and select the answer that you think is most correct, and we'll talk about it in just a few seconds.
Excellent, thank you, Paris. So this is our last question of the evening. Let's try to finish strong. We'll give all of you a few seconds here to respond. And then as always, we will go over the correct and incorrect answer choices. All right, I see the answer choices coming in. We'll give all of you a few more seconds here. Excuse me. All right, let's take a look and see what all of you selected. In first place with 50% was glucose 6 phosphatase deficiency, and in second place was debranching enzyme. So let's see what the correct answer is. And the correct answer is B, debranching enzyme. So challenging question, but Paris is going to explain it to you now.
Great, yeah, thank you, Sean. Definitely a tough question. So you can see here again, that table on glycogen storage diseases. We said it's pretty high yield. So let's take a look at type 3 Corey disease, okay? It says similar to von Gierke's disease. Okay, well, let's look at von Gierke's disease. We see that there's a fasting hypoglycemia. We see that there's increased blood lactate, hepatosplenomegaly, okay? But if you look at Corey's disease, it says it's similar to von Gierke's, but milder, and blood lactate levels are normal. So I think a lot of people selected glucose 6 phosphatase because it sounded like von Gierke's, but those lactate levels were normal, not elevated. So in Corey's disease, the deficient enzyme is debranching enzymes, which was answer choice B, or the correct answer, okay? So it's tough, it can be tough to differentiate between some of them, so it's important to know what are those key differentiators. So in this case, in this question specifically, it was that normal blood lactate level that told you it was not von Gierke's and maybe Corey's disease instead, okay? So let's go back to the vignette real quick, and you can see there that in that vignette, all of those things really are helpful. And even though it says lactate levels are normal, that's actually helpful in this question, the fact that it's within reference range, that lactate level. So that's the main factor here. You can see there was a lot of signs and symptoms, and each one of those is important. Because if you missed that lactate level, you very easily could have said von Gierke's and thus answer choice C, okay? Really quickly, we'll talk about the other answer choices and what those were getting at. So myophosphorylase, that's the question we just had on McArdle syndrome. So muscle pain with exercise, myoglobinuria, obviously not what we have here. Answer choice D is lysosomal acid maltase deficiency, which can lead to Pompe's disease. So classically, you would have a cardiomyopathy, hypotonia, unable to exercise. Not really hearing anything about that in this vignette. Glucose 6-phosphatase, as we mentioned, that's probably the closest answer, and one that I think a lot of people selected is von Gierke's disease. So a severe fasting hypoglycemia, and they did tell us that this patient did have hypoglycemia after fasting, but really it was that lactate level that stood out, okay? And then lastly, answer choice A, branching enzymes, that will lead to Anderson's disease, which you can get hepatosplenomegaly, but you wouldn't have signs and symptoms of hypoglycemia. So in this case, the best answer choice would be Cory's disease, and the enzyme deficient in that is answer choice B.
Excellent. Thank you, Paris. Great job, everybody. I know the last two questions were challenging. One mnemonic you can keep in mind, one that I've used when I teach, is ABCD. Anderson's branching enzyme, Cory's debranching enzyme. Okay, so Anderson's disease, branching enzyme, Cory's debranching. So A, B, C, D. But if you want more help and you really want to review these glycogen storage diseases or any other topic for that matter, we highly encourage you to take a look at RX Bricks. So this is the brick on glycogen storage diseases. As you can see, it starts off with learning objectives. Then we have a case connection, which helps tie this material to real life, right? Then we talk about, well, what are these glycogen storage diseases? And we walk you through it. And as you can see here, we have a table of von Gierke's, Pompe's, Cory's, McArdle's. Have some nice images here. Flashcards. This is the answer that most of you selected, right? Glucose 6-phosphatase. Then we have the clinical aspect as well of all these different diseases and their manifestations. Mnemonics to help you remember things. How do we treat it? Pompe's disease, and we keep going as we run through all of these different glycogen storage diseases. And as we see here, we have Cory's disease, and we have here named 3 ways that Cory's disease differs from von Gierke's, and we have here less severe hypoglycemia, no lactic acidosis, and may show muscle symptoms. So that would have been a good thing to look at prior to answering that question. McArdle's disease, another one we covered earlier. More mnemonics and flashcards. And as you come to the end, you will see a case connection. Again, it ties it back to what we started with, a summary of the key important take-home points, as well as practice questions so that you can practice your knowledge. Once you get it right, you will have a wonderful explanation of why that answer is right. And of course, you can review these learning objectives and mark them off. And then you can actually go deeper. You can study with flash facts, you can watch express videos, you can practice with QMAX. Now, for those of you wondering, the First Aid 2021 will be uploaded into the system sometime next month, okay? Their team is working on it as fast as they can. So once you have it, you can click here, go directly into First Aid. You can pick your topics here on the left side. As you can see, we're on the glycogen portion of First Aid. From here, you can go directly into express videos or flash facts. You can click different topics here and it'll take you right there, depending on what you select. So it's a wonderful tool to have the digital first aid where you can mark it up, take your notes, go directly into our different resources, and really stay organized as you're reviewing these dense and complex topics. You can also then add these to your study stream, and you can even create quizzes in QMAX. So you can either go to QMAX and create a test based on topic, or you can go to first aid. You can pick disciplines or organ system, or you can click on first aid topics and create your test that way by being as specific as you want to have that narrow focus when you're doing those focus questions. So, I highly encourage all of you to take a look at bricks if you haven't already. We have several bricks available. Many of them are actually completely free, and I'll tell you about that in just a second.